How does iodine trigger hyperthyroidism? Have you ever wondered how something as common as iodine can lead to a condition like hyperthyroidism? Iodine-induced hyperthyroidism, also known as Yod-Bosdo syndrome, occurs when there is an excess of iodine in the body. This can happen through various sources, such as iodinated contrast media used in medical imaging, certain medications, or dietary supplements. When the thyroid gland receives too much iodine, it can start producing an excessive amount of thyroid hormones, leading to hyperthyroidism. The thyroid gland plays a crucial role in our metabolism by producing two main hormones, thyroxine, often referred to as T4, and triiodothyronine, known as T3. These hormones help regulate many bodily functions. Under normal circumstances, the thyroid carefully controls how much hormone it produces. However, when there is a sudden spike in iodine levels, this balance can be disrupted. One important mechanism that usually helps regulate iodine levels is called the Wolff-Chaikoff effect. This effect temporarily inhibits the production of thyroid hormones when there is a large intake of iodine. It acts as a protective measure to prevent the thyroid from overproducing hormones. However, this protective response typically lasts about 10 days. After that, the thyroid can escape this inhibition and return to normal hormone production. For individuals with pre-existing thyroid conditions, such as nodular goiter or autoimmune thyroid diseases, this escape may not happen properly. Instead, the thyroid may react by producing too many hormones, resulting in hyperthyroidism. Several factors can increase the risk of developing iodine-induced hyperthyroidism. Individuals with existing thyroid issues are more susceptible. Additionally, kidney function plays a role because the kidneys help excrete iodine. If kidney function is impaired, iodine can accumulate in the body, raising the risk of hyperthyroidism. Another factor is oxidative stress, which can affect how iodine is metabolized in the thyroid. Dietary sources of iodine include iodized salt, seafood, dairy products, and eggs. Medical treatments that contain iodine, like certain contrast dyes or the medication amiodarone, can also trigger hyperthyroidism in some individuals. In summary, iodine can lead to hyperthyroidism by overwhelming the thyroid's natural regulatory mechanisms, particularly in those with existing thyroid issues. This is a recognized medical condition that needs careful diagnosis and management. If you have concerns about iodine intake or thyroid health, it is always best to consult with a healthcare professional for personalized advice.